like you are identifying glucose as a marker for diabetes, can we identify similar molecules in case of TB patients? So we need such complicated instruments, and this plot shows that there are three groups of TB. In TB biomarker we have three different groups of subjects available. First group is, let's say, healthy, like you and me. Let's say we are not exposed to mycobacteria, whether it is environmental mycobacteria or any other infectious strains of mycobacteria. If we are not exposed to it, then our skin test will be negative. And there will be another group of subjects where they are exposed to TB, they are infected with TB because their immune status is strong. So it corners the MTB inside the body. And those group of subjects we tell latently infected TB patients. And the persons who produces sputum and other clinical manifestations, and if we can identify MTB bacteria in the sputum of those patients, then we tell them as active TB. So in this figure, what we are showing is that the urine metabolite analysis of three different groups shows different profile. So how it will be useful for TB detection? Out of, let's say, 150 or 300 molecules that we have identified from the headspace analysis, we identified 5 molecules that are getting deregulated in TB patients, and hopefully deregulated in the sense their concentration changes in TB with respect to healthy. So is it possible to use these molecular details to develop some electronic nodes in future? That's what is our aim. And we are the first to show that in TB patients, when it undertakes TB therapy, we also see their urine samples cluster separately from the drug-naive TB patients. So what does it mean is that, let's say after 2 months of therapeutic intervention, the metabolites present in the urine of TB patients are different from the drug-naive one. Why? What could be the possible factor that is helping this 2 months treated subjects to cluster away from the drug-naive TB patients? The drug-naive TB patient has not taken any anti-TB therapy, right? But 2 months treated TB patients is taking every day couple of 100 milligram of anti-TB drugs. And those drugs will come in the urine, right? So if you take a patient's urine sample who has taken already anti-TB drugs, those molecules will be present in the treated subjects, but it will be absent in the drug-naive TB patient who has not started any medication. So that leads to the shift in the patient's urine sample. So these red dots are nothing but, these are all healthy subjects like you and me. After infection, their urine metabolite profile changes. After initiating anti-TB therapy, the molecular profile again changes. And why we need to follow these TB patients after taking TB therapy? It's because when a person comes to the OPD with the symptoms like 2 weeks of cough, weightless, night sweat and all, you get two groups of subjects. One is who has already taken treatment earlier, he was cured of the TB, but again TB reinfection has happened. So those cases are called relapsed TB patients, and we get close to 10% of the TB diagnosis is the TB patients are relapsed patients who has failed to take 6 months of therapeutic intervention, like who has not completed, or maybe they have got reinfection leading to reinfection can cause again disease, right? Either with the same pathogen or completely different pathogen. And whatever the important molecules we have identified, is it possible to differentiate from lung cancer, chronic obstructive pulmonary disease? What is COPD? Anyone has heard of it? What is lung cancer? Sorry? tuberculosis affects the lungs of a TB patient, of a patient, right? So lung cancer, cancer affects the lungs is lung cancer, right? So if we think or hypothesize that due to TB infection, we do expect metabolic alteration. We do also expect after cancer development, we do expect there will be altered molecular profile in the urine of lung cancer patients. So, actually, this region shows that is black dots are nothing but the TB patient's urine sample, and these red dots are the urine sample of lung cancer patients. So it seems like those 5 molecules what we have identified can differentiate lung cancer, chronic obstructive pulmonary disease, and pulmonary tuberculosis. And they don't get influenced with age and gender. And what is the future of it? It's like, is this molecular information can be taken to develop a electronic nose? That is what we are working on. And we have published a paper, maybe if you guys are interested, you can go through it. Okay. You all must be knowing Amir Khan, right? And you watched Satyam Eva Jayate? No. Yes. Can you recall what is the which episode it was? It was on tuberculosis. You know, the guy is sitting here is a clinician. His sister, and his name is Dr. Sekhar Khandri. You may not be knowing him. You know, in this particular episode, Amir Khan interviewed Sekhar. And what was his story? He's a clinician. His story, actually Sekhar's sister was also a clinician. Just after 1 year of completion of MBBS, she was doing job. And in December 2013, she first was diagnosed with TB infection. They initiated all sorts of therapeutic interventions. She was fine. And they lost her in June 2014. You know why? Because the MTB was present in the brain. So when MTB is present in the brain, what happens? The symptom is like the person suffers from hypoxia, and sometimes like the brain tissues are all damaged. So the person will faint, the patient will faint, and that condition is called tuberculosis meningitis. And for that, we don't have any easy to use diagnostic test. So we know about cerebral malaria, right? But you see, like when MTB enters the blood, like crosses the blood-brain barrier, goes to the brain, it's some way part of it. It's because, you know, MTB likes lots of lipids as its nutrient, not glucose, not that much to glucose. So it goes there, keeps on eating, and creating certain shock. So the patient gets faint, and once, twice, like we don't bother, like okay, that is a clinician from a healthy, rich family, so we think like nutrition is not a factor, but infection could be. Thank God, the family was from a well-to-do family, so they took her to the best hospital, private hospital in Bombay, but then she lost her life. So what is the message of this story is that early case detection, early TB diagnosis is the key. Can we diagnose TB early? So we came up with something like, you know, it's very interesting, don't waste your breath. Is breath can give us meaningful information. Like every time we go to the clinician for certain sedation and all, he tells like give blood sample, give urine sample, right? But anytime, have you come across that somebody is telling that give your exam breath sample? You go and blow a balloon and give that balloon as a sample matrix. In Delhi, it happens every day. You know, Every evening, the traffic police comes with a breath alcohol meter and monitors the blood alcohol level, right? So why not in infection? Is it not possible to use breath as a matrix for disease diagnosis? Okay. So our team is the only team in the country which works on breath-based biomarker discovery. So what we do is we tell, this is an overall schematic of what type of analysis we do. I'll not go into the detail, but lots of people are involved in this project. For the last 8 years we are working on it, and another 5 or 6 years we do expect that we'll come up with a solution. So what the breath is consists of lots of molecules. What are the common molecules? Carbon dioxide, carbon monoxide, oxygen. Anything else? Anything else? Sorry? Moisture. Yes. Lots of water molecules. Anything else? Sorry? Microorganisms, yes? If it is MTB also you may get MTB in your exam grade. Anything else? Dust particles, yes, absolutely. There are 3,000 to 3,500 molecules are present in the exhaled breath of a person, like healthy person. And it is consist of, like whatever we inhale, maybe this room air is very well filtered, nice. But if we go out to a subji market, or let's say behind a truck, you do expect your breath composition will change, right? And it may represent your physiology. If it is good, then you can find out like, okay, the appropriate carbon dioxide concentration is there, oxygen concentration is there. But is there any other metabolites also we can identify that may give some information about our immunity status? Like for asthma, people monitor nitric oxide in the exhaled breath. It's a successful diagnostic measure people have developed. So you monitor nitric oxide in the exhaled breath, and you get you can predict that the person is suffering from asthma or not. So why breath as a matrix, diagnostic matrix? It's because it's completely non-invasive, right? It should not be like for serum or blood sample collection you need to inject something, right? But for breath, you can blow out as much as you want, and it should not be difficult for the child, for the aged subjects, or for the adults. And you have unlimited volume, but it is a complex matrix. It's not like only oxygen or carbon dioxide is present, but there are lots of other metabolites of this. And as you rightly mentioned, somebody from the audience, like it contains lots of water molecules, and this high humidity leads to certain complication, and then you do expect change in the exhaled breath composition. Like after taking tea, before and after, you do expect certain additional molecules to be there, right? Sometimes we tell somebody that, oh, your breath is it's not smelling good, right? And I have a literally note. I'll taste at least 10 subjects' breath samples, and we'll get to know like whether they have done, yes, whether their oral hygiene is good or not. Okay, and what is the basic hypothesis? It's like TB. These blue rods are in TB. So when MTB is present in the alveoli, you do expect they will release certain molecules, or they will alter the basic metabolic level of the healthy subjects, leading to change in the composition of the exhaled breath. And if we can identify those volatile organic compounds, maybe we can develop a easy to use electronic nose. And there are some well-known volatile organic compounds markers like acetone in diabetic patients. Acetone level in the breath goes up, the abundance goes really high, and isoprene in hypercholesteremia, and lots of hydrocarbons comes like when people have problem with their liver, and bowel disease. So this is the schematic presentation of like how we collect breath samples. We go to the OPD, outpatient department of our collaborative hospitals. If a person comes with the symptoms, we request them to blow out in this plastic container. And this plastic container, the volume is close to 110 ml. So we repeatedly collect those breath samples, put it in the steam tubes. Inside the steam tubes, we have activated charcoals. Activated charcoals are used for making tandoori chicken and other things, right? But they have also good adsorbent property to trap micromolecules. And we take these tubes and heat it to 300 degrees centigrade. So whatever the molecules has been trapped inside, they releases, and then we use a sophisticated instrument that we have shown earlier for profiling breath samples. And individual peak here shows at least one molecule. So if breath composition would have been like composed of oxygen, carbon dioxide, nitric oxide, then we should have got 3 peaks here. But if you see it well, we have more than 100 to 150 metabolite. So we recruited close to 400 subjects and did some analysis, and we could find that the breath samples of latent TB, unexposed healthy and TB patients' breath profile are different. So this is more on academic exercise, and we're discussing about lung cancer. So these blue dots are the breath sample of lung cancer patients, and these triangles are the breath samples of, triangles are breath samples of lung cancer patients, and the blue one are of chronic obstructive pulmonary disease patients. From our statistical analysis, what we have seen is the TB patients' breath samples, they cluster separately than lung cancer and COPD. So it seems like breath composition of TB patients, lung cancer patients, and chronic obstructive pulmonary disease patients are different and could be useful for developing a aerosol noise. And these are all our collaborative clinical sites. 2 are in Delhi, 1 is in eastern part of India, CMC Vellore, southern part of India, and then 3 clinical sites, 4 clinical sites from northeastern part of India. And we're going to add 1 clinical site in Odisha and that will include issue. Okay, so I'll not go detail. So we always feel that human have this much, like our brain is the best property we have, right? It's the best in the whole animal and plant kingdom. But is it our olfaction system is also like that? No. Canines, the dogs, they smell better. They detect. They have much more better olfaction system because the receptors are more. So like that, you see, if an orange is, let's say, infected with some fungus, what we do? We don't take it, right? And same thing is done by the Drosophila. So Drosophila goes to the fruit. If certain molecules are there released from pathogenic fungus, they just go and eat there to get cross-contamination, like fungal contamination and all. It avoids. And how it avoids is based on the olfaction system. So in a penicillium infected orange, there is an increased level of jasmine. Jasmine smells like soil. And if it selects, if it identifies jasmine released from toxic mold, it stops feeding and oviposition. So similarly, MTB also releases certain micromolecules that has been tested and identified, and the molecules MTB releases is different from the molecules released by Streptococcus pneumonia that causes pneumonia disease, and Haemophilus influenza that causes influenza. So if we could identify those molecules in the breath of TB patients, then we can develop a dosage. So this is we are collaborating with the team from University of Utah and from United States and NDT, Next Dimension Technology from United States, to develop a sensor array based on the molecules that we are identifying that are specific to Indian TB patients, breath profile, and our proposed electronic node should look like this. And just for your information, rats, like African giant pouch rats, they can smell TB from the sputum of collected from TB patients, and even honey bee can detect presence of MTB in the sputum of TB patients. So why not? An electronic node? If we can mimic the olfaction system, can reach to that sensitivity, that low amount of MTB specific volatile organic compounds if we can detect, then we can develop the electronic nodes. So this is one of our competitor from United States. This is from Germany. This is from Technion, and this is from UK, and this is what is our technology looks like. So what you have to do is that you have to just blow out and detect. These are all the sensors, and these sensors will provide the information about whether you are infected with TB or not. Okay. So lots of people have involved in this project, and I think I have another 5-7 minutes. That sounds okay, or you guys are bored, or bored? Little bit?
No, sir.
Yes, sir.
No, sir.
Okay, somebody told yes, sir. It's good. Okay, I'll just talk about something different. You know, this child is suffering from and pneumonia affects the lungs, right? And pneumonia specific, the pneumonia causing microorganism releases different class of volatile organic compounds. So if you can develop sensor for that, then also we can develop an electronic node so that the kid doesn't have to stay in the hospital, because the simple antibiotics can cure childhood pneumonia. And you know how many kids we lose? Close to 17% only due to pneumonia. So they don't reach to the age of 5 years. So how many people we are losing, right? Just think about the parents who have only one kid, and they are losing the kid because of a small infection. Right? So is it possible to develop easy to use diagnosis? Yes, it's possible. And something completely different. Just like we are talking about proteins, like how many proteins are there in our body? We generate lots of biofluids starting from saliva, rich in amylase, so that all the food that we take, the carbohydrates can be digested and then can go inside. Then it also rich in lipase, so that lipid can be broken down. This is serum, which is very commonly used. The most attractive and commonly used matrix is serum, and this is urine, and this is sputum. So what we do is, we try to isolate the proteins out of it to understand the physiological stage of the infected subject, and we identified a couple of proteins like serum amyloid A, transthyretin. These are all inflammatory response proteins. I just want to show you something. Dhananjay is a collaborator of ours. He did his PhD from MIT, and you know what he uses is we commonly use silk, right? Silk and cotton sarees and all, and salt material and all. So is it possible that we can use combination of cotton and silk as microfluidics device? Is it possible? Microfluidics, people talk about like you put laser on plastics and make channels and then apply electricity to transport solute from one place to other. No? Okay. Let's say we have some charged molecules like X1, X2, X3, X4. So if you want to transfer them to another, another container, what we have to do? We have to use some external energy, whether it is electricity or any other thing. But if, let's say you have a curtain 5 volt and you want to transfer water molecule only in this direction, what you will do? Sorry? If you put a drop of water on your sword, it goes, no? It follows a path and goes. It doesn't need any electricity, right? So, let's say if we have 2 or 3 analytes to analyze, what we can do is so this is made up of cotton. This is made up of cotton 1. And here if we put silk, do you think water molecule will come from here to here? So simple weaving technology can be used for developing microfluidics. What people do is they develop very hi-fi, like they take plastic material and in that using laser, which is a very costly thing, they create wells in which the solvent passes. And you know, why they do it? It's because every time, it's just like razor, you save, every time you have to buy that blade, right? So this is, most of the American company and European company, what they think is that that's a business model basically, so that you develop a product and every time the user needs it, he has to buy it. So as it is made up of plastic and lots of engineering is involved, always the cost will be really high. So Dhananjay came up with a very good idea that why not to use cotton and silk in combination. And you see this silk is from Mysore and this channel is made up of cotton material. So if you want to detect something, let's say in case of pregnancy or in case of, let's say, some syndrome, the child is not developing well in the pregnant women. So you take amniotic fluid, put the fluid here, and there are certain antibodies attached to it. So from the fluid, molecules goes here. As there is antibodies attached, specific antibodies are there, the analyte will go bind there, and the color will change. And from that you can get to know like the person is suffering from that particular disease or not, right? So this is one tool, like one commonly used, like the resources is available in India. We have to be a little bit innovative to find out innovative solutions from the country so that we can use it maximum. So such pads you can make in million, and one will cost close to, let's say, 5 rupees or less than 10 rupees. Right? But if you take a plastic solution, something like this, you may have to buy it from an American company with a cost of 1,500 to 2,000 rupees. So it will do the same job of diagnosis, but again you have to always depend on external supplier. Okay, that's all. Thank you. Thank you for the work. Do you have any questions? Any questions? I finished it earlier. Any question? You have? You are taking some? Sorry? What is filter? Filter is a thick fluid that comes early morning. When you clean, it comes out. That is from the first fiber. That is little thick fluid comes out. Yeah. Huh? Which this is mentioned here. It's important.
Person known is all giving
TB infection, you need a test. You need to do a test. You have to do a test. You have to take certain samples if you are trained to test near microscopy. Reduce near microscopy and get
What are the symptoms?
symptoms. Symptoms we have discussed, no? 2 weeks of